everyone, my name is Brittany Magner. I am one of the dietitians here with Community Bariatric Surgeons. I've been here almost 5 years this summer, and my role at the office, and it's been my role all 5 years, is to do all of the pre-surgery education classes that you attend before surgery. So with this video today, we're going to first start off with give you an introduction to our program here, kind of what to expect with appointments coming up, and kind of know what is required of you to complete prior to surgery, prior to your paperwork being submitted into your insurance for approval. So right now, you're not doing a typical visit with us because of everything going on with COVID-19. We typically see all of our patients in the office. I see patients in a class setting and an individual setting. So typically for this visit today, if you would have been meeting in person, you would have been in a classroom with other patients, and we would have gone over all this information as a group together today. With today's visit, there are, make sure you watch all the videos in the email that you receive, and then there are some questions in the email asking you about your current weight, what you eat and drink throughout the day, exercise, and then asking you to set some goals. So please do make sure you respond to those questions to make sure we can complete your first visit with me today. So typically I would have you fill out a form in the class and we'd weigh you in the class. We are obviously unable to do that at this time. So if we are continuing with virtual phone visits, for the foreseeable future, you'll receive the same type of thing, a video like you are today for your next visit with me, and you'll be asked to respond back with some questions or some answers to the questions provided. But let's first get started off with our program and kind of what we have here at our clinic and what's expected that you do prior to surgery. So everyone has requirements that are set forth by your insurance, but then our program as well has requirements that we ask that you complete prior to surgery, and a lot of those do overlap. So we do ask that you, and your insurance requires that, that you meet with your surgeon, and some of you have maybe already met with your surgeon. Some of you may have that appointment coming up, but everyone will meet with that surgeon to discuss, surgery type and what's best for you. And then everyone is going to have what your insurance calls supervised weight loss classes, and that's your appointments with the dietitian with me. So today is your first class that you're watching with these videos here, and the next video is about the diet and nutrition information with that. So with the supervised weight loss classes, our program minimum is 3 visits. Most insurances require closer usually to 6 to 7 visits. Some insurance companies it is only 3, but no matter what, everyone will have a minimum of 3 visits with me. Insurance and our program do require that those visits are about a month apart. So if on your insurance sheet, so in your email, you also should have a sheet that is your insurance and program information, and that's going to be specific for you based on your type of insurance. So make sure you pull that up and read that document, because everyone who is watching this might have a different amount of visits with me. So let's say that number on your paper says 6 supervised weight loss visits. That means that we are going to be doing a virtual visit, or if we're back to in-person, but you'll be meeting with me no matter how we're meeting once a month for that many months. They're all in a group setting. If you're in clinic in the office, obviously we're not doing that right now, but everyone's 3rd visit is one-on-one with me, whether that's going to be back in our clinic or not. If it's not, you will receive a phone call from me, and that's usually about a 20 to 30 minute phone call for that visit. So if we're all starting in, let's say we're starting in April, May and June would be that one-on-one visits for that. So one other thing to point out is that most insurance companies do require that your visits with me are consecutive visits. So meaning, we're meeting once in April, we'll do another one in May, June, July. You cannot miss a calendar month, or your insurance will make you start over. So we understand things come up. We don't, especially if everything going right now, we don't want you coming into the clinic or office sick if we are going back to those in-person visits. But we, call us, let us know what's going on. We can get you rescheduled for another appointment if you cannot attend the one that you are currently scheduled with. We just need to make sure it's within that calendar month. Other than your visits with me, everyone will be asked to do some labs. So this is something else that's a little bit different with everything going on right now with the COVID-19. So currently, we're not recommending to go into the lab just to get these labs drawn right now. Probably waiting until things get a little bit back to normal again before doing the labs. However, it is required that they are completed before we submit your paperwork to your insurance company for approval. We're just recommending to hold off on those labs at this time, but you will receive the orders in that. We're just recommending that you do not do those right away with everything going on. Some of those labs that you're going to have orders for would be a hemoglobin A1C that gives us an average of your blood sugar over 3 months. We want that less than an 8% prior to surgery, or daily blood sugars under 200. If you know that your levels have been higher than that recently, we just want you working with your doctor who manages your diabetes to help lower that prior to surgery so that we have better healing and decrease overall risk for surgery with that. We'll do a lipid panel to get a look at where your cholesterol and triglyceride levels are. We're going to draw some vitamin levels of vitamin D, thiamine, and folate. And then we'll also do what's called an H. pylori breath test to see if there's a bacteria in the stomach that could put you at a higher risk for developing a stomach ulcer. So if that test comes back positive, we will treat you with antibiotic, and then we'll have you retake that test. So that test does have some specific instructions to make sure we can get an accurate reading for it. So nothing to eat, drink, or smoke an hour before doing your H. pylori breath test. And then if you've been on an antibiotic for any reason, you need to have been off of it for 2 weeks before doing the test. And if you take a proton pump inhibitor, common ones would be like Protonix, Nexium, Prilosec, omeprazole, pantoprazole would be a couple generics used to treat acid reflux. You have to stop that medication for 2 weeks, go do the test, and then you can go right back to taking it. During that 2-week time frame that we're asking you to come off of, like your Prilosec or whatever type of proton pump inhibitor it might be, you can use like a Zantac, a Tagamet, a Pepcid, or an Axid during that time. It just allows us to get an accurate reading by having you come off that medication. We also do a urine nicotine test on all of our patients. It is required that you are nicotine free prior to surgery. A lot of increased risks with that, ulcers, increase overall risks and complications with nicotine use. So if anyone currently smokes or use any kind of nicotine products, you do have to quit prior to surgery, and we need a negative urine nicotine. So let's say you quit today. I would recommend you wait 6 weeks before you go do that urine nicotine test. It does take some time for that to clear from your system. So do not do that one right away if you just quit smoking yesterday. Don't go do it the next day. It's not going to be cleared from your system, and you'll have to repeat it. And then some insurance companies do require a toxicology screen and a thyroid level. So those are just going to be based on your insurance. So if you receive that in your lab orders, those are just additional tests that your insurance requires. Toxicology screen will be another urine sample like the urine nicotine. And then the thyroid level is just going to be, they'll draw a little bit more blood. So technically the only lab that is fasting that we have talked about is your lipid panel. So nothing to eat or drink other than water 8 hours prior to doing your lipid panel. But you can do all these tests at once. So if you want to do it all at once, then you would just need to be fasting, no food or drink other than water 8 hours before for those. You can go to any lab of your choice, but if you do go to a Midwest America clinical lab, nice thing is that they do upload into the system. And you can go online to www.maclonline.com once you do go to do those labs, and you can find a lab near you. But we do have 2 locations at the Community North campus for those labs. But again, we are recommending that you hold off on doing those at this time. It's not urgent that you get them done right away. We just will have to have them done before we submit your paperwork to your insurance. The next piece is everyone will have a psychological evaluation with our staff psychologist, Dr. Stote. At the end of that evaluation, he'll let you know if he has any additional things that he is going to ask that you complete prior to surgery. If he does ask that you complete additional tasks or pieces, that will be required that is completed before we submit your paperwork to insurance. So sometimes he asks patients to meet with our counselor for 6 to 8 sessions prior to surgery. If you meet with a counselor regularly, he may ask for a progress report, a letter of support for surgery, just to give some examples. But we won't really know if there are any additional things until you sit down and have that interview with our psychologist. And then lastly, if your surgeon is Dr. Ditzler or Dr. Chang, you will have a final consult with them once you've completed everything else. Dr. Jones, if she is your surgeon, she does not require that final consult. However, you are still more than welcome to have one if you have additional questions for her at the end. Again, thank you, everybody. So that goes through all of our program requirements. If we do get to the point where we are allowed, which I hope we do, once we get to the point where we are seeing patients back in the office, you will be coming in to do your classes with me in person. If it's that third visit, it will be a one-on-one with me. So, hopefully I'll be seeing you in person much sooner than later. If you have any questions, please feel free to respond on the email or call our office. Have a good day. Bye.